Congratulations on receiving your braces today and starting your orthodontic treatment. We're excited to work with you in this amazing life-altering journey. A few things to expect in the beginning with braces is some soreness and discomfort. A lot of the soreness comes from when you're chewing, so in the beginning we recommend to have soft foods. Things like mashed potatoes, yogurt, smoothies, that kind of stuff that you don't have to chew too much into, because that's where a lot of the soreness comes from. And you may take Advil and Tylenol as needed. Also in the beginning you may notice that your tissue will feel rough. That's normal as well. That's just because the metal is rubbing against your cheeks and your lips, so it takes a little bit for a callus to form and for your tissue to toughen up against that. So just be patient and know that there is light at the end of the tunnel and that you will feel back to normal again. Everybody is different and everyone gets used to the braces at their own pace. So it may take a few days or it may take a few weeks. It's just dependent on you and how well you respond to the treatment. Oral hygiene is extremely important with braces. It is so important that you're keeping everything really, really clean, because if food and plaque is accumulating on your teeth and around the braces, you're going to run the risk of getting something called decalcification. And what decalcification is the enamel breaking down. And basically it's a cavity. So we recommend that you brush your teeth after every meal, or at least 4 times a day. And you should be brushing for about 3 to 4 minutes. So with brushing, we've given you this awesome power toothbrush. It is a great brush and we recommend that you use this whenever you can. When you're using this brush, I want you to make sure that you hold the brush to one tooth at a time and just do a circular motion around the tooth and make sure that the bristles are getting underneath the gum and all around the brace and underneath the brace. Okay, so one tooth at a time, just like that. Don't go back and forth because the brush is moving so quickly, you're actually going to skip areas of your tooth. So again, just one tooth at a time for about 30 seconds or so. There is a built-in 2-minute timer, and there is also a light at the back of the toothbrush. So if you are pushing too hard, it will light up and let you know to ease up on the pressure. But don't be afraid. This brush is made for orthodontic treatment and it's not going to break your braces. So just make sure that you're getting all areas of the tooth and the brace. And also, don't forget your chewing surfaces. You want to make sure that you're getting in between there as well and cleaning out any food or plaque that's on your teeth. And also you want to, again, on the inside, angle the bristles towards your gum and clean the inside of your teeth, okay? And making sure that the bristles do sweep along the gum line and underneath as well. Really important that you're doing this and keeping everything clean with your braces. All right, so flossing. Flossing should be done once a day, and just before bed would be the best time to do it. Flossing is going to be different. It's going to be a little bit of a challenge, but if you keep up with it and you keep it into part of your routine, you will become faster at it and it will become easier. So what we have here are called floss threaders, and we've given you a whole bunch in your survival bag here. But when you do run out, you can pick more up at Walmart or Shoppers. And what these guys are is one end is stiffened so that you are able to get between the tooth and the brace. So the best way that I find to use the floss threaders is always to push it away from your lip, because if you're trying to push against your lip, it's going to make it difficult. So for the top, always drop it down. So you're just going to drop the floss down in between the tooth and the wire, just like that. Then you're going to wrap each end firmly around your fingers, and you're going to bring the floss up, and you're just going to seesaw back and forth halfway up each tooth, or a C around each tooth. And then you're going to bring it down and do the other side. You're going to let go of one piece of the floss and you're going to pull with the other hand. And you're We're going to go in between each set of braces. It's really important that you're flossing every night because that same food and plaque that accumulates on and around your braces will also accumulate in your gum pockets. And if you're not removing the plaque from your gums, what will happen is you will get gingivitis. And gingivitis is red, swollen, irritated, puffy gums. They'll bleed very easily, and that's because there's an infection present. And when your gums bleed, that's the infection actually coming out. So it's super important that you're removing that plaque so that you don't end up with this infection. And if for some chance that you do, and you're not taking care of it, that infection can lead to something called periodontal disease. And what that means is over time, the food and plaque turns into bacterial acid, and they start to wear away the ligaments that hold the roots of the tooth to the bone socket. So once those ligaments are broken, that adult tooth is no longer supported in the bone and then will fall out. So that's why oral hygiene habits are really important, to keep up, especially with the braces. We do recommend that you see your dentist as well for regular cleanings and checkups. Every 6 months is recommended, but when you're in orthodontic treatment, you may want to go more frequently. You can go anywhere from 3 to 6 months. We've also given you useful little tools and aids to help keep your teeth clean on the go. So what we've got here is a little interdental brush, and basically this guy here does not replace brushing or flossing. It just ties you over to the next time that you can. So let's say you're out, at the movies or at a friend's house and you don't have access to your toothbrush. What you would do if you had this guy, and you should have him with you all the time, is you would just use it to get the food out of wherever it's stuck. So let's say something's stuck there, you just go ahead and push that little bristle brush in there, just like that, okay? If there's something stuck on top. And then rinse your mouth and rinse this really well before putting it away. Again, this does come in your survival bag, but if, once you see that it's gone dingy and it's expired, then you can pick more of them up at Walmart or Shoppers as well. We do also have a sulca brush, which is similar to the interdental brush. Either or is great. And with the sulca brush, we do have the travel case, so you can bring it out with you. Right. And then we have some wax. And the wax here is basically to provide relief in areas of discomfort. So if you have a wire that's poking, or a brace that's causing a cut or a really bad sore spot in your mouth, you would use the wax. So what I would recommend is you just take a little piece off, you roll it around until it's nice and soft and kind of pliable and easy to work with. Sometimes you have to dry the area of the brace with the tissue first to get it to stick. If there's saliva, sometimes it's hard to get the wax to stay on there. And then you would just go ahead and push the wax on and just pat it flat like a pancake almost until it's covered the brace completely. And then it will create a nice smooth barrier and it'll allow your tissue to heal. If you're covering up a wire that's poking, what I would recommend is cover it up with the wax and then give our office a call to have that wire clipped. And the wax should come out for eating and brushing. If you forget and you swallow the wax, it's not a big deal. It's wax. You'll live. So that's it for the wax. Going on to eating with braces. Eating with braces is going to be different. We're not going to try to take away all the foods that are yummy, and we're just trying to minimize the braces being broken. So essentially, you need to steer clear of hard and sticky foods. So when I say hard and sticky foods, I'm talking about hard and sticky candies, things like caramels, toffees, Starburst, Jolly Ranchers, that kind of stuff. You have to steer clear from. Those candies will definitely break a brace. So for the 2 years that you're in treatment, you kind of have to say goodbye to those guys. You can have chocolate, you can have different types of candies, you just need to be very careful. Also gum, especially gum like Hubba Bubba, they will break braces and they can make a huge mess as well and get stuck in different areas of your mouth. So those guys are also off the list. Peanut brittle, definitely steer clear of peanut brittle. That's very, very hard and it's sticky. It will break a brace. Popcorn you can still have, you just need to make sure the popcorn's fully popped. And try not to bite on those kernels because the kernels will break braces as well as breaking teeth, so you need to be careful. Nuts as well are very hard. You do need to be careful with them. You can try to eat a nut, but I would recommend one nut at a time. And if a brace does break, then you kind of have to kick that out of your diet. Ice cubes, definitely a no-no. Don't chew on an ice cube. It will always break a brace. Hard fruits and vegetables that are uncooked, things like an apple, let's use for an example. Biting into that apple, there is such a force when you bite down that you'll actually push the brace right off the tooth. You'll break it. So what we recommend with hard foods that are uncooked is to cut them up into small bite-sized pieces and place them towards the chewing surface, because there's a greater surface area for you to chew that food and a less of a chance to break a brace. Meats that are on bones, things like chicken wings and ribs, that kind of stuff, you want to take the meat off of the bone. Biting into a chicken wing, for example, you run the risk of biting into the bone and breaking a brace as well. So that's why it's important that you take the meat off of the bone. Things like corn on the cob, you can cut the corn off of the cob and eat it like that, or you can have frozen corn or canned corn. Basically, it's little tricks to eat with braces. You just have to find a different way of eating the things that you like. And that's everything. So congratulations again, welcome to the club, and we look forward to seeing you at your next appointment.